Hi, welcome to the webinar, Child Passenger Safety Laws and Correlations with Restraint Use, Injuries, and Deaths. This webinar is brought to you by the Child Passenger Safety and Occupant Protection Healthcare Project at the Maryland Institute for Emergency Medical Services Systems, also known as MIMS, which is funded by the Maryland Highway Safety Office. I'm Suzanne Ogaitis-Jones, and I coordinate the project. Together with Cindy Wright Johnson, my director, we are coordinating and monitoring this webinar. For those of you who are child passenger safety technicians, this webinar can be claimed for community education credit. Unfortunately, it does not qualify for the technical CEU. Tomorrow you will get an email that will serve as proof that you participated in this. So if you are doing it for community education credit, you will have proof of that. Okay, so I'd like to just go over what the goals of the webinar are. We're going to talk about associations between CPS legislation and the use of car seats, associations looking at injury and death data, some negative associations. We're going to cover the updated Maryland Child Passenger Safety Law and talk about how this law and its new components could potentially affect different groups. And we'll also have some talking points that you can use if you're educating particular groups about the law.
Of the people who are participating, and we have currently 64 people on, 38% are child passenger safety technicians, 13% are law enforcement, 45% are healthcare providers, 13% are safety educators or advocates, and 16% are others. If you do the quick math, you'll realize people were able to respond to more than one of the selections. And with that, I will turn it back over to Suzanne.
Thank you. That's actually extremely helpful for us presenters to kind of know our audience. So without further ado, I would like to introduce Dr. Sarton, and maybe some of you were on the webinar that she gave for us back in July of 2020. It was on the psychology of child occupant protection and research on car seat transitions, behavioral interventions, and disparities in child passenger safety. And she did a wonderful job on that. She does a great job at explaining kind of the big picture issues as well as the current research. So we really wanted to have her back to talk about her more current research, and especially as it's so timely with what's going on here in Maryland.
Thank you for that introduction. My name is Emma. Just to give a quick, I guess, overview of what we're going to talk about today. Obviously, I'm going to be talking about legislation and the correlations with restraint use, injuries, and deaths, as my title suggests. I will probably be talking for about 20 to 25 minutes, so I have plenty of time if people do have questions that they want me to expand on as we're going throughout this presentation. Just let me know. I can't see the chat, but I'm happy to stop and expand on anything that I might touch on. Because I'm not going into a lot of detail for a lot of these studies. So I'll be reviewing a bunch of studies and some of their findings at a very broad level. A little bit about me. So I am born and raised from Alabama. I attended I completed my undergrad education at the University of Alabama as a first-generation college student. I got a bachelor's of science in psychology. After my undergraduate career, I went on to complete a dual degree PhD in developmental psychology and MPH program at the University of Alabama at Birmingham. That was the time that I got very interested in and involved in child passenger safety. My dissertation was heavily focused on child passenger safety and car seat use in particular, which is largely what informed the previous webinar that Suzanne mentioned. During this time, I also became a child passenger safety technician and worked at the Safe Kids Alabama Coalition for several years. So after my graduate training, I went on to complete a postdoctoral fellowship heavily focused in injury epidemiology and traffic epidemiology at the Center for Injury Research and Prevention at the Children's Hospital of Philadelphia. I recently transitioned out of my postdoc into a research scientist position, but I'm still at the Center for Injury Research and Prevention, really getting to expand my child passenger safety research, as well as some work in a larger umbrella of transportation disparities and inequities. So next, I want to provide just a very brief background to get us all on the same page and thinking and approaching what I'm going to be talking about today. This is probably not news to most people, but I think it's helpful to see some updated statistics that we have coming in and just general trends that we're finding. So for motor vehicle crashes in the year 2020, so all of these data that I'm presenting are specific to children less than 9 years old. In 2020, it was the second leading cause of unintentional death for this age group. Specifically, 675 children died in a crash, which results in about 41,000 years of potential life lost. When we look at age-adjusted fatality rates, we see that this is about 1.7 per 100,000 children dying in a crash. And we also see important differences based on who the child is. So males are more likely to be killed than females, and we see disparities based on race and ethnicity, with marginalized populations being more likely to be killed in a crash than white children. As an example, I have, so Black children are killed at rates that are about 3 per 100,000, compared with about 1.5 per 100,000 for white children. That being said, we have made substantial progress in reducing the overall fatality rate for child passengers who are less than 9 years old. So these graphs show the overall age-adjusted fatality rate from the year 2001 to 2020, and I have that dotted line representing the split in the decades. So if you look at this first decade, the aughts, you can see we started off at about 3.5 children per 100,000 dying in a crash, and we ended that decade closer to about 1.8. So there was a substantial reduction over time in the fatality rate for children. We have also interestingly seen in the last decade, we're kind of stagnated. We haven't really seen much more of a reduction in that overall rate. And while this graph, you can see that really nice decrease in the first decade, I do want to point out my y-axis on this graph is not at 0. It's not starting there. So there is still a pretty big jump that we could make to get this even further with more efforts and ideas moving forward, but that's another talk for another time. Today, I want to talk about why we saw this really sharp decline in that first decade, so from 2001 to 2010. And this decline can be attributed to a few things based on some research. So first is improvements in vehicle technology. Vehicles are much safer than they used to be. In particular, we've seen a lot of improvements in vehicle technology that's available in the back seat of a car to protect passengers. This includes child passengers. So we see like curtain airbags are more common. Seatbelts are made even a little bit better than they used to be for the back seat. So in general, we're seeing really good improvements in vehicle technology. We've also seen an awareness and an increased awareness and uptake of child restraint systems. Throughout my slides, you might see this abbreviated as CRS, just to save some space. So I might say CRS, but child restraint systems include car seats that have a harness, so rear facing or forward facing, as well as belt positioning booster seats, with or without a back. So any type of a restraint system specifically designed for children. Over the last 2 decades, there have been enormous amounts of interventions and community efforts trying to get more parents to use these systems. And they've largely been effective. And then lastly, we've seen, especially in that first decade, so from 2001 to 2010, there was a flurry of new laws and different types of legislation passed focused on either mandating child restraint system use or improving child passenger safety in various ways. So I could do a whole talk and presentation on how these 3 things have together worked to reduce that fatality rate, but today I'm largely just going to focus on the impacts that we've seen in legislation. So a little bit more just specific information about child passenger safety laws. All US territories and states and many countries around the world have some type of child passenger legislation. These laws require children of certain ages to be restrained in specific ways while they are traveling in vehicles. So it's a very broad definition of what they do. Importantly, all of these laws, including in the United States, vary by the type of enforcement that they follow. So some laws are primarily enforced while others are secondarily enforced, meaning if it's a secondarily enforced law, a police officer cannot pull over someone if they see that a child is not correctly restrained. They can only kind of add on an additional ticket or some sort of citation if in the event that they were pulled over for something else. We see that these laws vary based on the child's age requirements. So some children are not within like the umbrella of a law. So some laws only go up to the age of 6 for kids, others go up to age 7 or higher. We see that laws vary in what they're recommending for restraints. So based on the child's age, some might say, rear facing for children less than 1. Other laws we see recommend rear facing for children less than 2. Different types of vehicles may or may not be required to have a child in a restraint system. And then lastly, the consequences of law. So not only how are they enforced, but what happens if a caregiver is found to not be in alignment with what the law is saying. All of those things might vary from law to law, even from state to state. Like even if they're next to each other, these can look very different on all of these different categories. And because of all of these differences, it can be a little tricky to understand what real-world effects we see when a new law comes to pass. And with that in mind, that was sort of our motivation behind this study that we did. So our main question was, how do child passenger safety laws influence behaviors and crash outcomes? The study was published in Injury Prevention last spring, so in 2021. And that's the title and the information for it. I'm happy to provide more details about this study for anyone if I'll post my contact information at the end of this for anyone who wants to see more details about what we did. I'm not spending a ton of time on our search process for this, and I'll touch on that in just a minute, but again, I'm happy to share more details with anyone. So the objective of the study was to conduct a systematic review to identify and characterize studies evaluating the effects of child passenger safety policies. Our primary points of focus were to understand how different laws' common traits and how they differ from municipality or territory or state to state. We wanted to better understand associations between laws and child restraint system use and behaviors. We wanted to understand how these laws impact crash outcomes, so child passenger injuries and fatalities. And we wanted to know more about how laws impact various populations. So how do people respond to them? For search criteria, we did a really broad sweep. I think it took us almost a year to do this systematic search. We used various search terms across different search engines, and our primary criteria were to find studies that assessed legislation's impact on at least one of these 3 outcomes. So several of the studies I'm going to describe looked at multiple of these, which is why the numbers are not going to add up every time. But they had to do at least one of them to be included in our study. So first, looking at child restraint system use. So this is just yes or no, a child is in any child restraint system. Then we looked at correct or appropriate child restraint system use, and I'll define what I mean by that in just a moment. And then we looked at child passenger injuries and fatality rates. The studies had to be published between 2004 and 2020. We picked this time frame because it represented the most recent time, like most recent 15 years or so when we were conducting the search. And there was a study published in 2004 that reviewed studies looking at laws before 2004. So we wanted to pick up and update what's been done since that time. We didn't want to repeat what that study had already published. And we did not limit our studies to any region, so they could be from anywhere in the world. After our search, we identified 18 studies that fit all of that criteria. So 9 were from the US, 3 were in Canada, 3 in Australia, 2 in Chile, and 1 in New Zealand. And by the outcomes they assessed, 9 reported on overall rates of child restraint system use, 10 looked at correct and appropriate child restraint system use, and 6 looked at injuries and fatalities. First, I'm going to talk about the impact on child restraint system use broadly. So again, this is the child is in any child restraint system use. It doesn't have to be the correct one based on our best practice guidelines or even being used correctly. It's just a child restraint system use is being used in the vehicle for the child. So in these studies that looked, there were 9 of them. In these studies, child restraint system use was measured at the general population level as well as by specific age categories. And it was also measured using caregiver self-report, so caregiver saying, yes, I'm using a child restraint system, crash data, and roadside observations. The laws themselves that are included in this category were focused on strengthening existing legislation, so changing laws that were already in practice, enacting booster seat laws, so new laws that mandated booster seat use, or a combination of the two. So sometimes when government was trying to enact a new booster seat law, they would also update their existing legislation. So focused on the US first, in one study in New York City, there was a 72% increase after a law was passed for child restraint system use in 4 to 6-year-old passengers, which is a huge gain. In 5 states that had just passed booster seat legislation, child restraint system use was 3 times higher. In Connecticut, after laws were strengthened, another study reported that child restraint system use was 1.3 times higher. And in a large study that compared rates of child restraint use at a time before any booster seat laws were enacted, so the year 1999, to a time after booster seat laws had been enacted, so 2009, the study found that overall child restraint system use really increased for children 4 and above. So specifically, we saw a 9 to 41% change among 4 to 5-year-olds, less than 1% to 23% among 6-year-olds, and then less than 1% to 12% among 7-year-olds. And then in Wisconsin, after a law, overall, there were fewer children unrestrained. There's an asterisk next to this study because there is an important nuance that I'm going to discuss in just a minute. So overall, though, more children were in some sort of child restraint system. Other countries also had similar findings. So in Canada, among 4 to 8-year-olds, in 4 to 8-year-olds that were in locations that had some sort of law, 24.6% of those children were restrained, compared with 16.6% of children who were in locations that did not have any laws. And these findings were verified by a study a year later using different methods, which is important in research to see. And lastly, in New Zealand, 5 to 9-year-olds had a 2.5 greater odds of being restrained after a new law was passed. So again, we're seeing really great increases in overall rates of child restraint system use for children following a law being passed or changed. Now transitioning into this idea of correct or appropriate use. So 10 studies reported on this. And depending on the study, the definition of what correct or appropriate use changed. So many studies define this as child restraint use that was correct based on the child and seat fit established by either the law or by best practice guidelines at the time that the study was published. So that was one category. So the child, for example, who was 4 years old was in a belt positioning booster seat, which is what the law said that they should be in. That would have been a correct use of a child restraint system in that study. Another definition was that there was no errors in child restraint system use. So for example, the child was harnessed into the seat correctly. So that's like actually an execution of the child restraint system use. And then lastly, the one study looked at whether or not the child restraint system was correctly installed into the vehicle itself before and after a law. And all of these outcomes were measured using caregiver self-report again, so the caregiver reporting on the child age and the type of restraint system that they might be in, and then observations from researchers, so at different locations, so roadside and I believe daycares for these. In the US and Canada, a telephone survey before and after the enhancement of a law in Nova Scotia found that appropriate use of forward-facing seats increased from 74% to 92%. and appropriate booster seat use increased from 58 to 95%. So again, we're seeing really positive outcomes. Another study in Canada found that higher rates of correct restraint use for 4 to 8-year-olds. So this was that follow-up study that I talked about a second ago that verified the children who were in provinces that had some sort of law were more likely to be restrained. This one found that those children were also more likely to be correctly restrained as well. So there was an association with correct use as well as overall use in provinces that had some sort of child passenger law compared to those without. And in the US, 4 to 7-year-olds were 39% more likely to be correctly placed in booster seats in states that had laws compared with states that did not have laws. And that was based on caregiver self-report. A few Australian studies, so before and after a law was passed, 2 to 5-year-olds observed at daycares had 2.3 greater odds of being appropriately restrained based on the law's recommendation. So after the law went into place, 2.3 greater odds of being correctly and based on your age. And then 1.6 greater odds of being accurately restrained based on the manufacturer's instructions for that seat. So we did see an improvement there, which is very exciting. In survey responses in Sydney, another study did find an overall increase in the appropriate child restraint system use based on the child age. And again, here are some asterisks, because while there was an overall increase in appropriate child restraint use based on the child age, the study also reported that nearly 50% of 3-year-olds in their study were prematurely transitioned into a booster seat. So a lot of their gains in that study were for booster seat age children and older. So we saw more children being put in booster seats, which was positive. However, we did see this premature transition happening. Also, another study reported that 79% of observed child restraint systems still had at least one error after a law was passed in how it was either installed into the vehicle itself or how it was being used. So that execution factor. So just because they were using a child restraint now didn't mean that they were using it correctly. Also, an important nuance, while overall use increased in one study, only 60% of children were correctly restrained according to the child's height and weight and the manufacturer's instruction. So again, if you look broadly at, like, maybe they were definitely now in a child restraint system, which is positive. They were not lining up with the child restraint system's manufacturer's instruction. So it wasn't a good child seat fit. Also, so this was the study I first referred to, had an asterisk. So overall, there was an increase in Wisconsin for child restraint system use following a new law. Despite that, the majority of urban children remained inappropriately restrained, and marginalized groups, particularly those from certain racial and ethnic backgrounds, were more likely to be prematurely transitioned into booster seats. And then lastly, in Tennessee, again, we did see that positively, overall, there was an increase in the appropriate booster seat use rates overall in the state. However, there was no increase in Black caregivers use, and Black children remained 2 times as likely to be unrestrained as white children. Additionally, there was a decrease in the number of children who were less than 4 who were appropriately restrained, which suggests that there were, again, premature transitions happening after this booster seat law was passed. So lastly, talking about crash injuries and fatalities and how laws change those after they are passed. And again, these are associations, but we're hopeful that this is, a lot of these are really strong associations. So these studies, there were 6 of them, examined injuries and fatalities using crash, fatality, hospital discharge, and hospital inpatient data. Overall, we saw that in one study in New York, there was an 18% decrease in the injury rate for 4 to 6-year-olds. And there was no difference in children less than 3 years old, which makes sense since this law was focused on that 4 to 6-year-old category. Using the kids inpatient database, Another study found that children covered by booster seat laws were 22% less likely to be hospitalized for crash injuries. This study did note important income and racial and ethnic disparities, with those from lower SES and marginalized groups still being at a higher likelihood of needing to be hospitalized for crash injury. In Chile, there was a 35% reduction in severe injuries for children who were under the age of 4 after a new law was passed. And then across multiple states with booster seat laws, there was a 50% decrease in the injury rate per capita of child passengers for that state in booster seat ages. There was a 17% decrease in fatal and incapacitating injuries, and 3 to 8-year-olds covered by laws, so in states who had these types of laws in place, were less likely to be hospitalized than children who were not covered by laws. Focusing now on fatalities, in the United States, so states with booster seat laws have fewer fatalities for 4 to 7-year-olds than states that did not have booster seat laws. In Chile, a pre to post study, meaning they looked at rates of fatalities before the law and rates of fatalities after, found that the overall fatality rate for child passengers less than 4 years old reduced from 1.71 to about 0.89 per 100,000 vehicles. However, and importantly, a different study looking at that same law found a zero change in the fatality rate. So they used slightly different methods and didn't find that same drastic reduction, which is important to note. So overall, studies reported positive associations between legislation and outcomes in child restraint system use, accurate and appropriate child restraint system use, and then crash injuries and fatalities, with some important notes. So first, there were differences in how populations responded to these laws, specifically in the categories of different racial ethnic groups, different types of education, so people who were higher educated versus lower educated, income levels, and language differences. Many of these laws reported a substantial increase in premature transitions into booster seats. There were a wide variety in the types of laws and methods of the different studies used to assess these outcomes, which is an important note. And all of these studies that I just reviewed were conducted in similar countries. So there wasn't much of a cultural difference or different types of backgrounds I would suggest. So it's important moving forward for us to understand, especially to understand how different populations might respond to these laws, to do these types of studies in other locations. For future research, just a few recommendations I have. So it's important we better understand why populations respond to these laws so differently. It's also important for future researchers to distinguish the effects of different types of laws. So I had that list of how these laws might vary from one another. This is a systematic review, so all I can do is just tell you that these are the types of laws and this is how they changed. But I am unable to tell you that, you know, the magnitude of having it being a primary versus secondary law changes these outcomes by this much. We're currently not able to do that type of a study. However, future research really needs to do that. As far as real-world efforts for recommendations go, many studies that we reviewed suggested the need for tailored and effective messaging and education to accompany all legislation changes. Specifically, there's a need for the information that is contained within a law to be disseminated across multiple languages and across multiple platforms. So this is the idea of meeting people where they are, and as well as like how they might understand what's going on a little bit better. So putting things into lay people terms, you know, I am arguably very highly educated. I still have a really hard time with legal jargon and understanding whenever these new laws come out, what exactly they mean until they are translated for me. And then multiple platforms. So understanding how people get information today versus how they used to obtain information previously. And then these studies also really highly recommended the use of dissemination efforts for child restraint systems in particular as new laws are coming out and attention is put on them, and the use of community-based partners. So when you're disseminating these seats, working with local churches or daycares and places that children are going to be, to really help spread the message, the education, and those resources that you might have available. Just very quickly, I'm going to leave this up for anyone who might be looking at the recording of this or wants to come back. This table is from our study, and it has some notes about the type of law that we saw, what the law did, or just general study notes that we thought were important for the reader, as well as how they conducted their study and where. So I'm just going to, again, I'm going to show those for just a second so whoever would, might be interested in it can see it. And then here's a list of the studies that were included in our analyses, or our summary, I should say. And that is it. I'm happy to take any questions now.
Okay, well, people might be thinking of them, but why don't we switch over to Myra Weeman from Maryland Highway Safety Office, and she will start to talk about Maryland's updated law.
Thank you, Suzanne. Thank you, Cindy. And good afternoon, everybody. It's nice to be here with you all. I am Myra Weeman, and I am with Maryland's Highway Safety Office. Our office falls under the Maryland Department of Transportation, otherwise known as MDOT. Specifically, our office is within the Motor Vehicle Administration, also known as MVA. I have been the deputy for the Highway Safety Office for almost 3 years now. And prior to that, I spent over 30 years at AAA Mid-Atlantic in their traffic safety, public affairs, and government relations department. Today, I'm just going to spend a few minutes talking to all of you about the new child passenger safety law that will go into effect on October 1st here in the state of Maryland. Before I jump into that, though, I just want to real quickly remind everybody of how car seats prevent injury. Just like a seatbelt for an adult, a car seat is going to keep a child from ejection. It's going to provide head, neck, and spinal column protection. And that seat's going to absorb the crash forces instead of the child's body absorbing those forces. And last, but certainly not least, many of you have heard the term ride down. And a car seat is going to help that child's body safely come to a stop, otherwise known as ride down. I think this picture is worth 1,000 words when we talk about the importance of rear facing as long as possible. In this picture on the left, you can see a child that's rear facing and the body absorbing most of the crash force and how that head and the neck and the spine receives support. On the right side, you can see in a forward-facing car seat, the head, which is disproportionately large in toddlers and heavier in toddlers, is thrown forward, and this could possibly result in some form of spine or head injury. So that's just a little bit of background on why the Motor Vehicle Administration decided to propose an administrative bill, which is actually going to enhance our current CPS law. So right now, our law states that every child under the age of 8 must ride an appropriate child restraint, unless they're 4'9" or taller. It goes on to say that 8 to 16-year-olds that are not in a car seat have to be secured in a seatbelt. So we went over the current child passenger safety law, and in addition to that current law, the new child passenger safety law, effective October 1, states that children under the age of 2 must ride rear-facing until they reach the weight or height limits specified by the car seat manufacturer. So let me get into a little bit about why the new law and why the Motor Vehicle Administration and the Maryland Highway Safety Office and multiple police agencies determined that this would be a good proposal to legislation. This new law brings Maryland in line with 16 other states and the District of Columbia. It's important to note that 2 of those states are bordering states, Pennsylvania and Virginia. We also feel that this law provides better guidance on what really has been best practice advice for years. It's not intended for law enforcement to go out there and just write tickets. It's intended for law enforcement to be able to educate drivers. It's going to give better parameters for these officers, and that will allow them to begin a conversation much easier on rear facing and best practice of rear facing as long as possible. Now, please keep in mind, this law, like many laws, is a minimum standard, and therefore education and outreach is really going to be the key to best practice. Anna Lewandowski, who also works for our Highway Safety Office, is going to go into that a little bit more when she shows you some of the collateral materials that our office developed with that point in mind. And just as a side note, we did a large car seat donation program with the help of KISS, one of our grantees. And this is one of the police officers holding up one of those seats that we did donate to police departments throughout the state, so that in the event that they do have to transport a child, they can do so safely in a convertible seat that is rear facing as well as forward facing. I just wanted to end by showing everybody the Maryland code for child passenger safety seats. Anecdotally, when we speak to law enforcement, and we do that a lot, as a matter of fact, my director and 5 of our staff are at the Maryland Chiefs and Sheriffs conference that begins today, and they'll be there all week. So they'll be working and talking with many, many law enforcement officers. But anecdotally, the majority of child safety seat violations are due to children not being in a seat at all. That means that an officer has observed a child completely out of a seat, or there was a child involved in a crash and there was no seat present. So I think it's important for people to understand, when they see the numbers of violations that are written, the majority are because of those 2. So as a reminder, under Maryland Code, children under age 8 not secured in a safety seat is a primary violation. And as Dr. Sardin explained, primary violation means they can stop the vehicle for that. The penalty is an $83 fine. And with the new law, if an officer does see a child that they believe to be under the age of 2 in a forward-facing seat, they will be able to provide education and a written warning on the first offense. And that's key. It's going to be a written warning. It is not going to be a fine for the first offense. There's much more information that you can find out. We have a 1-pager that goes into greater detail on the history and the background of why the MVA submitted this proposed legislation, which will be law again October 1st. And you can find that information on our website, zerodeathsmd.gov. You can go to the road safety section on the top navigation bar, and then just click on child passenger safety. And again, thank you for your time.
Thank you, Myra. That was very interesting to hear about the law and the details, and thank you for giving a little background in case anyone's not too familiar with the how and why, the physical aspects of child passenger safety. We're going to now start to have our panel, and this would be several different people who are representing different occupational groups that they can reflect on how the law is going to, the updated law is going to affect their their occupational group. So we're going to start talking with a couple of law enforcement officers. Our first panelist will be Detective Sergeant Rob Petrus, who's with the Maryland State Police, and he's currently at the Westminster Barracks. And Rob, in addition to being a highly valued state police officer, he also is a child passenger safety technician. So we're delighted to have him.
Great presentation so far. So not only as a speaker for a few minutes here, I'm also learning a lot, and so I appreciate the speakers who preceded me. As indicated, I'm a detective sergeant here at the Maryland State Police Westminster Barracks, criminal section supervisor, and also a child safety seat technician for several years. One of our goals in the state police is make travel on Maryland roads safer for everyone, especially our young people and especially our little ones. So we are all doing the best we can on that. The new law passed, and like with any new law, and I'm certain most Maryland law enforcement agencies are similar, a summary of all the new laws that was passed came out earlier this year in the springtime, went to all Maryland state troopers for them to review. And I know in my personal case here at the Westminster Barracks, I'm providing the materials that I've obtained to educate all the troopers here assigned to Westminster with the new law, information on the new law. I also have another child safety seat technician here with me, and we do safety seat checks, etc. In reference to the new law, it'll just be incumbent upon most Maryland law enforcement officers that have our electronic ticketing program known as ETICS to check the history on the motorists to see if they've been stopped for this violation before. If they haven't, as stated, they'll be issued a written warning, again, for educational purposes. That's our goal, to educate everyone to make Maryland roads safer for everyone. If they see in the ETICS history that the motorist has been issued a warning for this violation, they can issue a citation for this violation. Police officers who don't have the luxury of having the electronic ticketing program can run a computer check or have a computer check run for them to see if the motorist has been issued a written warning for this violation. So it's imperative that all law enforcement officers do that. That's basically all the comments I have. If you have any questions, I'll be here for the question and answer period at the end of the webinar. And as usual, for any questions you may have for law enforcement related, if we can be of any assistance, speaking for the Department of Maryland State Police, call any one of our barracks, call our headquarters 24 hours a day, 7 days a week, and we'll be glad to try and answer your questions. If we don't know the answer, we will certainly find out and we'll get back to you. But thank you for your time. And again, I'll be here for the question and answer period if anyone has any.
Great, thank you, Rob. I'd like to now turn the voice element of GoToWebinar over to Sergeant Dove Robeson from the Prince George's County Police Administrative Hearing, the Internal Affairs Division. She is an administrative hearing officer there, and she has been a longtime child passenger safety technician, and she's also an EMS provider, busy person. Dove?
Good afternoon, everyone.
Yes, thank you.
Good afternoon, everyone. As was stated, I am a police sergeant with Prince George's County Police. I've been nearly 20 years a child passenger safety technician. So I wear two hats. Besides just being law enforcement, I also volunteer as an EMT. So I'm going to try to cover what I'm doing with both and what the police department in Prince George's County is doing. Currently with the police department, we're just learning and trying to figure out how this law is going to impact our enforcement efforts. Currently, it's going to be education, and we do have in Prince George's County, because we are considered a underserved area for child passenger safety, because it seems to be an area that it's needed. We do have during Child Passenger Safety Week, we're going to have a education and information session on September 20th in the afternoon. The address will be at our old headquarters at 7600 Barlow Road in Landover. I've tried to get the slide in here, but my computer wasn't working right. But again, from 5 to 7 p.m. at 7600 Barlow Road in Landover, we're going to do an information session to educate the public about the new law and how it's going to affect children, and in the future, warnings, and then it can lead to citations. But mainly, as the police department, we are going to do more of an education rather than enforcement at this point in time. And our media relations division will start pushing things out when it gets closer to the Child Passenger Safety Week and when the law actually goes into effect. And on the flip side, where I volunteer with the fire department, we host several seat checks during the year now that things are getting back to normal after the COVID shutdowns. And we also do more of an educational, we do all educational and with these seat checks. Things that we're currently doing that we're setting up now is we have an open house in October where I will be doing a display with child seats and giving information about the new law and how it's going to be enforced in the future, and how the importance is of keeping children rear facing till 2. I say we do have a traffic unit in Prince George's County with Prince George's County Police, and they are more or less just doing education when they see the violation. It's not an enforcement at this point in time. I'll be available for questions afterwards. It's like that if anyone has questions, either with what I'm doing, the EMS side with the fire department, or with the police side.
Great. Thank you, Dove. We're going to roll right on to our next panelist, Dr. Mary Beth Howard, who's an assistant professor of pediatrics at the Johns Hopkins University School of Medicine with a clinical expertise in pediatric emergency medicine. Dr. Howard?
Hi, thank you for having me and the opportunity to speak about what is, I think, a very important change in Maryland law. And so, as other speakers have mentioned, infants, we know, and toddlers are at particular risk for neck and spine injuries after car accidents because of their large heads. And we know that rear-facing car seats provide optimal support to the head and spine in the event of crash. And I see this in my clinical practice in the emergency room at Johns Hopkins. From a pediatrics perspective, the initial age cutoff of rear-facing until 2 came out of a study in 2007 that found that there was a decreased rate of injury for kids aged 1 to 2 years when they were rear-facing versus forward-facing. And this subsequently led to the American Academy of Pediatrics in 2011 recommending that all children remain rear-facing until age 2. So as a pediatrician, I'm very excited to see this recommendation now become law. After this recommendation in 2011, it prompted many car seat manufacturers to update their products so that children can remain comfortably rear-facing until age 2. I think it is worth mentioning that more recently in 2018, the American Academy of Pediatrics updated their child passenger safety recommendations to actually remove the age cutoff and instead recommended that children ride rear-facing as long as possible until they reach the weight and height limits of the car seat, which these days for most car seats is until about 40 to 50 pounds, so well over the age of 2 years. I think it's important for pediatricians, we ask about car seat safety at most routine well-child visits. I also ask about it anytime I see a child or family in the emergency room following a motor vehicle accident about their access to a proper child restraint, and make sure to emphasize the importance of keeping children properly restrained, including rear-facing until 2. I think that having this now as law further emphasizes the importance of this in keeping our children safe when they're on the roads. And my hope, as I'm sure it is for all of you, that with this, the partnership between pediatricians, public health officials, traffic officials can reduce some of the morbidity and even mortality that we see from motor vehicle crashes in young children.
Great, thank you very much. Well, again, keep rolling along because time flies, and we're going to hear now from Antoinette Summers. She is a birth doula for her company, Birthing Tranquilly. She works with expectant and postpartum mothers in Washington, D.C. and its Maryland suburbs, and her passion for educating her clients extends to child passenger safety, as she will be taking the technician certification course next year. Antoinette?
Yes, hi. Thank you for having me. Good afternoon, everyone. Yes, I am a mother of three and a doula that serves this area. And as a doula, it is part of my responsibility to provide educational resources to parents and making sure that they are aware of infant car seat safety. So with the new law, with the changes in the law taking place, I just find that it is part of my duty to make sure that my clients are aware of it taking place and just making sure to provide, to know that they're knowledgeable on how to provide continuous car seat safety. I also wanted to just say that since learning about the changes of the law, it's been my intention to promote it on the different platforms and the mom support groups that I have an active role in, as well as raising awareness within the Black community. And I am definitely looking forward to taking my child passenger safety training so that I can continue to spread awareness and make sure that things are done properly to help bridge the gap in every way that I can. Thank you
Thank
so
you.
much.
Thank you, Antoinette. Just because we're rushing through our time here, we're going to switch over and start to talk about some of the promotions of the new law and child passenger safety. And we're going to hear from Anna Lewandowski, the communications manager at the Maryland Highway Safety Office. Go ahead,
Hi,
Anna.
everyone. My name is Anna Lewandowski. As Suzanne said, I am the Communications and Media Section Manager for the Highway Safety Office. I am in charge of all campaigns that come out of the Highway Safety Office, including this new child passenger safety law. So today I'm going to show a very quick preview of some of the ads we will be that are currently in market now, and then we will continue our campaigns after October 1st. Right now, we are investing over $100,000 in this campaign to alert parents and caregivers of the law changing on October 1st. So right here, I have a preview of some of the ads that will be running, and you will see throughout all of these campaigns that we never talk about the enforcement aspect of it. As Myra talked about, it's more about the education, the outreach. So we want people to know about the change. We're not saying you can get a ticket or anything like that. So this is one example of a story. I'll go through social media first. Here's another one, just ensuring people are using the correct seat for age, height, and weight. This is a Facebook ad. And another one. And then this is our digital display ad. This will be running on websites. If you ever are Googling and then you see ads on different websites, this is one of those ads that will pop up. We are targeting it to websites that the general age range would be those who have young children. So we are trying to hit that age range. We also have some Google ads that are running. So the list. If any of these search terms are put into Google, our ad will show up at the top, and that is prompting people to go to the zerodeskmd.gov website. So if people search something along the lines of these items, this is what will pop up. So we have car seat weight limits, car seat installation, booster seat size, correct car seat size, car seat laws, child road safety, recommended car seat, child passenger safety, child car restraints, Maryland car seat laws, driving with children, and kids in safety seats. So those are just a preview of some of the search terms that if those show up or people put that into Google, our ad will begin showing. I also want to take this time to show what our zerodeskmd.gov website. As Myra mentioned, under road safety, we have child passenger safety here as its own page. But currently also in the Digital Resources Center, we have our September Toolkit that is available for download. It has graphics and copy for social media, and it does have a lot of pieces about Child Passenger Safety Week coming up next week, as well as the new law changing. In the coming days, we will also be developing a child passenger safety specific toolkit that we will have on here. And once we finalize all of our collateral materials, they will be available for download from the same Digital Resources Center. That is all I had. Thank you.
Great, thank you, Anna. Claire from Maryland Kids and Safety Seats is going to say a few words about what they are doing under the Maryland Health Department.
We are continuing to, well, you'll see the law flyer in the handouts, and hopefully you'll use that to provide caregivers for a simplified version of the revisions to the law. But basically, we're going to continue taking the opportunity that this has provided for awareness to talk about the importance of extended rear facing, with 2 being a minimum. And I've heard a lot of people stating that that's the same educational messaging they're going to continue to use. So we really appreciate that, because best practice, the law is a guideline, it's a minimum, but best practice is really beyond that in terms of keeping children safe. So that's all.
Great, thank you, Claire. As Claire mentioned, we do have some handouts available through GoToWebinar, and here they are listed, but go ahead and download those. Those should also be available through my website at MIMS, and a lot of them are through Zero Deaths Maryland as well. Now we really would like to have time for question and answer. I know we are pushed a little bit for time, but hope you can stay on the line so that we can have some questions from you and have our panelists answer as best as they can. So Cindy, what do we have?
We have 2 questions that are different vehicles, but ask whether or not the current child passenger safety law or the additional component for rear facing till 2 following height and weight recommendations apply to school buses. And there's a question of whether it applies to taxis or higher for hire vehicles, Uber, Lyft, and whatever the latest to those are.
Claire, do you want to handle that, or would you like me to?
I can, or one of our law enforcement
Right.
panelists, but basically all of the vehicles Cindy mentioned, buses, for hire vehicles that are registered as such, are exempt from the law, but Lyft and Uber, because they're personal vehicles, are do have to follow the child passenger safety law now and in the future. So it's really based on how the vehicle is registered, and I'll let the law enforcement folks pick up anything I left off.
Any more comments? Rob or Dove?
I don't have any additional comments. Claire is usually the subject matter expert I reach out to when I have a question, or someone else at Kids and Safety Seats.
Okay.
But as you stated, they're exempt.
Right, so it gets really tricky with the for hire things like Lyft and Uber, because technically the driver of that vehicle would get the ticket if a child is not buckled up, as opposed to the parent. So I have heard anecdotally that some of those drivers will not take kids because, unless they are in a car seat, because the driver would get the ticket.
That's my understanding. Taxi cabs are still exempt because they are exempt under the law, but Uber and Lyft are not exempt.
Right, it's very tricky, isn't it? All right, do we have another question, Cindy?
Yes, there's a question that says the new law requires caregivers to use a convertible seat. They're worried that a caregiver will state that the child outgrew the infant seat, and therefore they felt they were in compliance with the under 2 by using a convertible seat forward facing.
Who wants to handle that one? I can say something about it. This is going to be a point where education is really key, because what we really need for parents to do is to move their child from the infant seat to the convertible seat. And most parents, most kids are going to outgrow their infant seat around age 1. They're going to outgrow it by height long before they reach the weight limits for that seat. But then they need to move their child into the convertible or the all-in-one seat and use it rear facing to those weight limits, or at a minimum till the child is 2. And I think, as Dr. Howard said, most of those convertible seats can be used for rear facing till either 40 or 50 pounds. So really, children can stay rear facing a lot longer than they used to be able to, and longer than age 2.
And Suzanne, that echoes one of the questions that I had gotten very early on and took a stab at answering myself, which is what happens if the child is overweight and is still less for an average child, an average toddler, and less than 2. And the response I gave was that the law does allow for parents to turn a child around if the seat weight or height limits are exceeded by their individual child, but that best practice would be, as possible, to get a seat that has a higher weight limit rear facing. Someone who is still currently certified is welcome to correct me. That was an early on question.
Right. And just as kind of a side note for anyone who's not familiar with some of the resources available in Maryland, we have a number of places administered by Maryland Kids and Safety Seats, or working in conjunction with them, that provide low-cost car seats. We at MIMS have been getting some car seats to hospitals to give out to families whose child cannot be discharged unless they have a car seat and they are not able to get a seat on their own. So we're really trying to do something about making sure that access to car seats is not a problem for people, because we know it can be. Car seats can be expensive, but we really are trying to make sure that if they need a car seat, they can get one.
There's a brand new question, which is very technical. At what
Cindy?
weight is the latch system no longer able to be used rear facing, regardless of type of car seat?
That is going to depend on the specific car seat, because it's the child weight plus the car seat weight cannot exceed 65 pounds. So some of these car seats are over 20 pounds, and therefore somewhere in the 40-pound range may be the maximum to use lower anchors to install the car seat. But seat belts are always available, or at least we hope that's the case, and that's what we recommend at that point.
Thank you, Claire. There are no other technical questions. There is a legal question, and it is not specific to the law, but it does come up in conversations. One of the benefits of the law being primary enforcement was if the co-parent is refusing to transport the child appropriately, and the custodial parent would like to have support from law enforcement to ensure that the child is being positioned appropriately. With the additional law moving towards a warning, how will this help the custodial parent if a co-parent wants to move a 1-year-old forward facing? I don't believe we have any child custody lawyers on the call, but I will open that up for coaching advice.
If no one
Cindy,
else, oh, go ahead, Myra.
this is Myra. I'm not really sure exactly how to answer that question. I could definitely pose it to our traffic safety prosecutor, Dave Daggett. He has been very helpful to me in interpreting this law. And then maybe, Cindy, I could provide the answer to you, and then you could disseminate it to the group. Would that work for you?
Absolutely, that would be perfect.
And then if I can, I just wanted to make one quick comment on the question regarding prematurely putting a child into that forward-facing seat. Keep in mind, a lot, if not most, of these seats now have on the modes of use, they have verbiage such as can and should. So they may say that a 20 to 40-pound child who can sit upright unassisted can be forward facing, but it also has 40 to 65 pounds should be forward facing. So there's some language on those stickers that is can and should and can and must. And I think, again, that's going to be a big part of our education and outreach, is explaining that terminology on the sticker. Thank you.
That does conclude all of the questions that have been typed
Okay.
in.
Okay. I just wanted to jump back a moment. What Rob Petra said about the e-ticks, that, the police officers should have the ability to look and see the history of ticketing. So if that provider who's not doing the right thing with the car seat has already had a warning, then after that, they're open to getting a ticket. The first time they are pulled over for not having the kid rear facing, that's when they would get the warning, but thereafter they can get the ticket, which is a $50 ticket that ends up being $83 with court costs. All right. This was also one of the handouts I just want to mention. I put this together, and if you can use this somewhere, feel free. But this is a quote from Colonel Kevin Anderson of the Maryland Department of Transportation Authority, who's a very big seatbelt and car seat advocate. And the picture on the left was taken from a press event earlier this summer. As a reminder, you will be sent an evaluation form immediately when you close out the webinar, and then tomorrow you will receive an email that will confirm that you participated in this webinar. Again, we can't offer technical credit for car seat technicians, but you can use this for your community education component. And if any of you need a certificate of participation for whatever reason, please just email me at cps@mems.org, and I'd be happy to send that to you. So thank you so much to all our speakers, all our panelists, all our attendees. I hope this was as helpful to you as it was to me, and I hope you all stay safe and take care.